So what happens if your newborn baby, toddler, or child requires surgery, especially life-saving surgery? You'd want the best specialists in the region to work on them. If that's the case, then the experienced team of leading pediatric surgeons housed right here are here to help.
Well, we have pretty much the entire spectrum of specialists, from the general pediatric surgeons that do a lot of chest and abdominal work, pediatric urologists, pediatric neurosurgeons, pediatric orthopedic doctors. So we have a spectrum that allow us to take care of the baby. And since most of us are really good in certain areas but don't know a lot about other areas, it takes the whole subspecialty spectrum to really do a good job.
Dr. Keith Georgeson should know. As one of the leading pediatric surgeons in the country, he chose to come to Sacred Heart because of that ability to work with such a diverse group of specialists.
Medicine has become a team sport. I mean, there's no way one type of specialist can deal with all the needs of a tiny baby, particularly a premature, but even newborns that have major medical problems. And that's why having a team available where difficult decisions have to be made, it can be made in that context.
You know when you have a good surgeon, and I have just been so pleased to have the surgical team that we work with here. And I have every confidence when I send my patients to them, it's because I know they're going to take good care of them.
We also use specialists like surgeons, specific surgeons specifically for neonatal babies and neonatal problems. We deal with GI specialists to help us deal with some of the nutritional and some of the liver problems that we see in early newborns. We deal with neurologists and neurosurgeons to help us with some of the neurologic and the brain growth issues and some of the complications that the brain incurs when the fetuses are born early. We use almost all of them in the NICU.
I've worked in children's hospitals all my life, big ones. The one I came from in Alabama was a greater than 400-bed hospital and was a standalone children's hospital. And the care we deliver here is equivalent to the care we had there.
It is that kind of care that is demonstrated in the surgical techniques that Dr. Georgeson has spearheaded as a leader in the field of pediatric minimally invasive surgery.
Often it's the access that we use that is so noxious to the patient. A big stripe across the abdomen as an incision is very painful and affects the lungs, it affects the heart, it affects how much fluid collects in the abdomen. And so if we can minimize that insult, then we can do the procedure and not have some of the bad things that happen after a big incision. And so that's been my special interest, and it's gradually sort of pervading surgical procedures, and I see it advancing every year. There's no other place this side of Seattle or say Salt Lake City or Minneapolis, so that covers a pretty broad swath. There's no other place like Sacred Heart Children's Hospital and what we offer. And I think that every child, every infant deserves the very best. So I would recommend that when your child or your newborn has a problem, this is the ideal place to bring them, because we have this team of doctors, this team of nurses, and then all the other things that go up to make up high quality care. We have that here.
The surgery went just fine.
There's also this sense of a real personal physician. One of the reasons I chose to come to Sacred Heart was because I saw that personal relationship, which I value a great deal, and I think parents do. You know, we try to be reassuring. Sometimes things are pretty critical, and we have to communicate that. We'd like to always say, oh, everything's going to be fine, but we have to be honest, and I find that honesty and integrity is here. And in the end, that really makes parents more secure. They know they're getting the straight talk and not just being reassured falsely.
Dr. Georgeson and the rest of the pediatric surgeons here really do a truly remarkable job. Up next, working with the hospital's tiniest patients.
The reason you enter neonatology, I think, is because you get to deal with very sick babies, but what you do from the beginning is to offer hope.